Good morning and welcome to the Georgia Institute for Plastic Surgery. My name is Jim Glazier, one of the anesthesia providers here. We just finished up breast augmentation with Dr. Greco. Everything went perfectly, and now our patient's ready to receive their post-op instructions.
Good morning. Hi, my name is Betsy Smith. I'm Dr. Greco's RN, and this is our patient Terry. She's had a breast augmentation under the muscle. She's ready to go home. So I want to go over the instructions with her today, okay? First off, Terry, remember that you have on a bra and an A-strap. The bra will stay on. The A-strap will stay on till tomorrow, okay? Keep an eye on your breasts today. Make sure that they stay pretty much symmetrical. Remember, they're pretty even. We make sisters, not twins, okay? So one side always is a little more swollen than the other. One side always hurts a little more than the other.
Okay.
I do have to tell you, though, that there is something called a hematoma. It's a complication. It will not kill you, so to speak, but the pain is pretty painful, intense. You might feel like it's going to kill you. But the difference will be, it'll be very large, and you can actually see it as the pocket grows up here, okay? It'll be a huge difference. It will be hard. Sometimes the patients will call and say, I can physically see it getting bigger and bigger and bigger.
Okay.
And all of us know that that's pretty much a hematoma. Rarely does it occur. I think the last time it occurred, it was on a patient that got very anxious, upset, and emotional, which does cause your heart rate to increase, your blood pressure increase, all those things which increase bleeding. So just take it easy today for the next few days, okay? Tomorrow you can take your A-strap off along with your bra and take a shower, okay? Just remember, don't use like a sponge or a washcloth because they harbor bacteria. When you take your bra off, take off all your dressings, meaning your adaptic, which is exactly on your incision, your 4x4 with tape. You have that on both sides. Take them off, take a shower. You can reapply that bra or a bra that doesn't have any underwire, just something that's comfortable and supportive to you, okay? Remember too, you have on your TED hose. These hose will help prevent blood clots, but with that you still have to get up and walk around at least every 1 to 2 hours, okay? Cough and deep breathe. Those can come off tomorrow before you take a shower, as long as you're walking around and getting around good. When you go to stand up or sit, remember you don't want to use your chest muscles or anything like that, so use your legs and your abdomen, your core to lift you up, all right? Take your diet slow today. You've had crackers and some ginger ale. I know you like to drink water, as you told me in the past. Don't force water immediately today. I prefer you try to take in some more food. People that have a tendency to like a lot of water, they drink it and they keep drinking it every time they get nauseated. So just take it slow and then work back up to that once you're eating something well, okay? Next, we want to talk about your medications. So you got your medication pre-op, so you know you got an antibiotic before you went back for surgery. Tonight, start your antibiotic, or today at lunch actually, start your antibiotic once you eat something. Start bland, rice, baked potatoes, something that's not too greasy, fried. For heaven's sakes, not Mexican or Crystal or something like that. Nice and slow. You take your antibiotic today, and then you can take it tonight, and then you take it 4 times a day. So just plan to start the whole regime tomorrow, okay? You're not allergic to penicillin, so you got Keflex. You would take that breakfast, lunch, dinner, and before you go to bed. Somebody that is allergic to penicillin would get what's called a Cleocin or clindamycin. That pill would be taken 3 times a day, which would be with breakfast, lunch, and dinner. As far as your pain, you haven't really complained of pain to me. You said it's very tolerable.
Correct.
With that being said, I'm not going to give you a pain pill because you only live in Richmond Hill. When you get home, try Tylenol. See if that helps you. If the pain does not, if it continues to get increasingly worse, then by all means take a Percocet. If it's not terrible and the Tylenol controls it, then stick with that. Only because pain medicine, nausea, vomiting, all that stuff, rather you not have to deal with it. Okay? Any questions or anything that you have for me?
I don't think so.
Remember that also, since we did go under the muscles, you do need to do your arm exercises. And if you remember what we talked about, just up, yeah, and out, and then kind of around and around a little bit. And that will keep your pectoral muscles open, okay?
Okay.
Just don't overdo it. It's nothing strenuous or anything like that.
Okay.
And remember, you'll be coming back to us in 5 to 7 days. At that time, we'll go over everything else, how to do your implant exercises and how to massage your scars, which are 2 different things.
Okay.
But we don't go into that in too much detail because we want you to just get rest, get well. If you have any problems or complications, just give us a call, okay?
Thank you.
You're welcome. See you soon.